Cosmetic surgery is extremely popular in North America today. We know from studies that in fact 2/3 of both women and men would be interested in changing at least one of their facial features. So knowing that, one might ask the question, why aren't more people having cosmetic surgery? One of the biggest reasons that people often tell me is they're concerned about the risks, and they have a perception that it's very risky surgery. So I'm going to tell you a little bit about the risks of cosmetic surgery. The first thing that everyone worries about, it seems, is the general anesthetic, or indeed even local intravenous anesthesia. You should know that anesthesia today is generally very, very safe. And depending upon where you live, you are in fact about 5 or 10 times more likely to die in a car accident this year than you are to die or have a serious event having cosmetic surgery. However, you tend to drive your car on a regular basis, you don't have surgery very often, so it seems like a much greater risk. So the really serious risks, such as having a heart attack or a stroke, are very, very minimal, and we take every precaution to make sure that you're safe. When we think of the surgery itself, yes, any surgery can be associated with some bleeding, some infection, some problems with tissue healing. Once again, we will discuss all of these issues with you, and the reality is that 99% of patients do just fine with all of these various potential problems in the sense that they just don't have them. It's also important, particularly if one is more senior, that you're medically fit. And one of the things we always do is have you check with your family doctor or any other specialist as necessary, along with our anesthesiologist, to make sure that you're going to be a good candidate for surgery. And finally, one of the most important things is, how do you feel about surgery and what are your expectations? Your surgeon and I will be able to tell you whether you're a good candidate to get a really good objective result from the surgery that you're considering. But what's also really important is to know how you would like to have your life changed by having this surgery. And so if you have realistic expectations and you're reality-based as to what can be performed and done with cosmetic surgery, then the probability is very much in the high 90% range that you'll be very satisfied and that you can have not only an improved objective appearance, but very much improved feelings about your appearance and an improvement in your quality of life. And that's our job, to see that we can minimize your risks and achieve that high degree of satisfaction for you.